Hello guys, welcome back to my YouTube channel. My name is Kelly Sams to those who do not know me, and today I want us to speak about this topic that many of you have been asking me, many of you have been inboxing me, DMing me about it, and I want us to talk about family planning, about contraceptives, and when deciding what contraceptive you want to use or which family planning you want to use, there are different things that you need to consider. And today I want us to talk about those things, and then right from there we can talk about the family planning methods and their advantages and their disadvantages. But today I want us to look at the things to consider when choosing the right contraceptive. So welcome once again to the new subscribers. Thank you for clicking. Thank you for coming. Come and learn together. Let us learn together. And to you who is watching this video and you haven't subscribed, please hit that subscribe button and turn on the notification bell so that anytime I post a video, you will be the first one to know I have posted. So without wasting any more time, let's get into it, guys. So the first thing you need to consider when you want to choose the right contraceptive for your body is how frequently do you have sex? The first thing is, how frequently do you have sex? Are you the type of a person who has sex every month, or are you in a long distance relationship where maybe you have sex maybe once in a year or twice in a year? Like, how frequently do you have sex? That is one question you need to ask yourself before choosing the right contraceptive. Because if you have sex once in a year because you're in a long-term relationship, then you won't need to do like the everyday pill contraceptive. I hope you get what I mean by that. You need to ask that yourself that question of how frequently do you have sex. Another thing is, how many partners do you have? That is a really important question. You need to find out, are you married to one guy or are you dating multiple guys? That also needs to come, that one comes in handy when choosing the right contraceptive, because when you have one partner, you will want to choose a contraceptive that you won't consider getting STIs, sexually transmitted diseases, because in your mind you have one partner. But if you're having multiple partners, you might want to consider a contraceptive that involves protecting yourself from sexually transmitted diseases and also HIV. So how many partners you have really is a question you need to ask yourself before choosing the right family planning. The third question or thing that you should consider before choosing the right family planning is, do you want children? Do you want children? What is your age? If you just maybe hit 20s and maybe you want children, there is the right family planning that you need to use, because you want a family planning that won't affect you, that in future when you want kids you will be able to have children. But if you have already gotten the kids that you wanted, maybe you have 3 4 kids and you have said this one is enough, you don't want any more kids, then you will be able to know which contraceptive that you want, because you don't want children anymore. I hope you get it. If you want children, and if so, another question, a thing that you need to look at when choosing the right family planning is, if you want children in future, how soon do you want them? How soon do you want them? Do you want them next year? Do you want them in 6 months? Do you want them in 10 years? Do you want them in 5 years? Thinking about that, thinking about how long you want to stay before having a child is very important. So you need to think about how soon you want the children, because if you want them maybe in 6 months time, You will know which contraceptive that you will use that doesn't take you too much time. Also, if you want kids in 10 years, you will know the longest contraceptive maybe you might want to use. Or yes, you need to consider, if you want children, how soon do you want them? The next thing that you need to consider is how effective is that family planning method that you have in your mind. How effective is it? You need to do research about it. You need to talk to your doctor about it so that you can be sure. I had people saying this contraceptive is good. You need to have all information to know how effective that contraceptive is, because you don't want to start using a certain family planning and then later, 2 months, 3 months, you are pregnant. So you need to really just get information about that contraceptive that you are planning to get. You need to know how effective it is. Another question is, what are the side effects of this contraceptive that I want to use? You know, there are many contraceptives and they come with their different side effects. So if there is a certain family planning method you have in mind, you really need to find out, or to know, to get the information of the side effects it can bring to you, because some are mild, others are severe side effects. So you need to come out with a plan on how to get information about that certain family planning method you have in your mind and what side effects it can bring you. And also, I think this is the last thing that you need to consider is, what is your health history? Your health history is very important when it comes to choosing the best family planning method. This is because there are certain contraceptives or certain family planning methods that really get impacted when you are using other medications. So if you have a certain history of a certain maybe disease or some sickness, you will need to consult your doctor on which family planning method is right for you. You can't just go and pick this family planning and just use it without considering your health history. You will need to do more research about which family planning methods come in handy with whatever your health history is and the side effects, and also uh, how soon you want children, or maybe if you don't want children, you need to do research. These family planning methods, some of them are safe for those who want children in future, and there are others which are permanently, uh, like the one you remove your womb. That one is a permanent one. You will not get kids in the future. So you need to research, ask your doctor some question for you to choose the right contraceptive. In my next video, we will talk about the advantages and disadvantages of some of these contraceptive. And guys, thank you so much for watching to this far. If you haven't subscribed, please subscribe, guys, and I will see you on my next video. Bye.